Good evening and welcome to another edition of the Yuba Sutter Medical Explorer. My name is Dr. Robert Peppercorn and my specialty is dermatology. I serve as host of this program. The purpose of the Medical Explorer is to explore the medical communities of Yuba and Sutter counties and to take you behind the scenes of medical care practices in our local area. We have another interesting show for you tonight as we observe the operation of the new mammography machine at the Marysville Medical Clinic, which can detect breast cancer earlier than any other technique available in modern medicine. We will also meet with one of our area's most highly trained specialists in internal medicine and learn more about one of our most feared diseases, the disease of cancer. Before getting to our topic tonight, let's begin with some medical news. Is Medicare in financial trouble? A study released by the Congressional Budget Office has determined that the Medicare program may be facing serious financial problems. This disaster may be resulting from the withdrawal of $12.4 billion from the Medicare Trust Fund. The funds were withdrawn to bail out the Old Age Benefits Trust Fund of the Social Security system. The study indicated that the Medicare Trust Fund could be bankrupt by 1988. The annual report of the Medicare Trust Fund shows that the fund will be depleted by 1989 or earlier if the Social Security system does not pay the interest owed on the money that was borrowed. Switching now to some better news, the American Cancer Society has reported some potential promising new ways to treat cancer. A new way to destroy cancer of the uterus is about to undergo its first human tests at UCLA. A 15-minute surgical procedure that destroys cancer cells with heat has been performed successfully on the cancerous uterus of a baboon and other animals. In the new tests, the new thermomagnetic technique proved much more effective than radiation in sweeping the uterine area clean of cancer and reducing the chance of cancer spreading. Each year, 40,000 women die of uterine cancer in the United States when it spreads to other parts of the body. And finally, doctors at the Mayo Clinic report that a vaccine has been developed against a virus that causes both mononucleosis, the kissing disease, and two rare forms of cancer. In tests so far, owl monkeys vaccinated with the new preparation are protected against all the diseases caused by the Epstein-Barr virus. Human tests may be ready to start within a few years. Now, on with the Medical Explorer. As you can tell from the news, doctors are continuing to discover new ways to find and destroy cancer. The most common form of cancer in women in the United States is cancer of the breast. Let's visit the radiology department of the Marysville Medical Clinic and explore a new way to diagnose breast cancer. Today, the Medical Explorer takes us back to the Marysville Medical Clinic, where we're going to look at a new, extremely modern piece of medical technology, a new mammography machine which allows us to look for breast cancer. The Marysville Medical Clinic made the effort and recently purchased this machine. Let's go into the mammography room and meet with a radiologist who's had a lot of experience with this device. Today we're with Dr. Spencer Silverbach, one of Marysville Medical Clinic's excellent radiologists. Dr. Silverbach today is going to show us the new mammography unit that the Marysville Clinic recently purchased. We're standing in the room right now where that mammography unit sits, right behind us. Dr. Silverbach, thank you very much for being with us today.
It's a pleasure being with you today, Dr. Peppercorn.
Thanks. Could you tell us a little bit about how much of a problem is breast cancer in the United States?
As of today, breast cancer will strike approximately 1 woman out of 11. The death rate is still quite high, and it is a necessity, I think, and it is supported by the American College of Surgeons, American College of Radiology, and American Cancer Society that women undergo annual mammography breast examination annually after the age of 40. And some even believe that a baseline study as early as age 35 be undertaken.
How would a patient get the orders to come here? Would they have to see their internist first, family practitioner first?
Yes, all of this is done only on a referral basis.
They can't just walk into the clinic and ask for a
nobody can walk in and just be given a blank request saying go ahead and go ask to have a mammogram done, because the reports by necessity are given to other physicians for interpretation to the patient.
Tell us a little bit about this fantastic looking machine back here. What is it called, first of all?
It's called a Senograph 500T, and it's made by the CGR company, which is a French company. CGR stands for Société Générale Radiographique, and the unit was designed initially about 5 years ago and has been out in the field doing quite first-rate work with film screen mammography. It differs from the more popular and probably more well-known Xerox technique in that it uses a very low intensity, low dose radiation, and therefore is felt to be quite a bit safer than the other more common and longer used Xerox mammograph.
So the patient is exposed to much less radiation with this device?
Absolutely, much less.
In this area, who else has a machine like this?
The Woodland Clinic has one identical with this, and Dr. Max Brennerman up in Auburn also has one identical to this.
But no one in the Yuba City, Marysville area has one, so this is the place to be.
This is the place to be. This is the state-of-the-art machine, and it costs the clinic about $75,000 as you see it standing here.
$75,000, that's a lot of money, but it does a lot of good, I understand.
Yes, it does.
Can you show us how a patient is fitted for the machine and actually gets the x-ray taken?
Absolutely. Rhonda here will act as our model, and we can show you approximately how she would be positioned for the overhead or craniocaudal view. The patient will place their chest wall directly up against the machine, and the machine is lowered into position with the breast being placed between the compression device and the plate on which the film would be held, and the compression device lowered into place, and quite a bit of compression to the breast made. Then the radiology technologist, who would be standing approximately where you are, would operate the machine and fire the x-ray machine off so that an exposure could be made. The tube head then can be rotated. The patient can be repositioned. Sit back just a little. And what can be done is, as necessary, the patient is then repositioned in this mode, and after another exposure is made, the tube head is rotated again all the way over into this mode, and the patient is repositioned in such a manner.
So you can get all angles of the breast here.
That's correct.
Not miss 1 inch of breast tissue.
That's right.
Fantastic. Does the patient feel any discomfort when this goes on?
There is a considerable amount of discomfort, I'm afraid, when the compression device is used. It is not the kind of pain that is unbearable, but it is a fair squeeze.
It's a pressure feel.
Yes.
It's not really a pain or a needle feel.
No.
Nothing like that. So I've had patients go through this sort of thing, and they never complained of any discomfort.
No, it is not comfortable, though.
Not comfortable, right. But the information gained is very useful and be worthwhile to get.
Far outweighs the discomfort.
A little bit of pressure feeling.
Yes.
Well, let's go over to your office now and actually look at one of these films and see what the information actually does that comes out of this machine. Okay. We're now standing in Dr. Silverbach's office. Dr. Silverbach, why don't we start by looking at some normal films from the mammography machine?
All right, fine. On the top we have a picture of the left breast, and on the bottom and on the other side, the right breast. And what we can see very clearly here is the skin line, the nipple shadow, and the inside of the breast. And on both of these, the breast insides are very homogeneous. That is to say that the quality of the tissue under the skin is all the same, and this is commonly seen with a fatty breast, which is also seen in elderly people.
What are all these little lines that we see here?
Well, the breast tissue is made up of connective structures which come up slightly more radiodense than the surrounding fat. And as well, besides the connective tissue, there are small vessels which you can see in the breast tissue as well.
Okay, so this is the actual size of the breast from this particular person?
Yes, that's correct. We have the capability also of doing magnification on
enlarging one particular area to see more detail.
That's correct.
Now let's move down to someone that unfortunately did have breast cancer. Can you show us a little bit about that?
This is somewhat deep in the breast tissue itself. As you can see, the breast tissue is not all fatty, but mostly fatty. This is in the very high area where it occurs with most frequency. It's up near the armpit, near the edge of the breast, but this happens to be very deep against the chest wall. This is almost an inch across. It has somewhat rough edges, and it is very dense, as is better seen on this study, to the X-ray beam when compared with the surrounding tissues.
Do you know if the patient's referring physician was able to feel this lump?
Apparently not. This was very dense, very deep, and the patient's referring physician was able to send her in because she felt pain, discomfort.
Pain. Interesting. So discomfort alone can be a warning to get checked out, not just actually feeling a lump.
That's correct.
Let's go over again what the recommendations are for someone to get breast examinations and mammography.
Well, the breast examination should occur with every physical examination that a woman has.
So if she's not getting one, she should ask about it.
That's correct. Then it is recommended in some quarters, and most specifically the American College of Surgeons, that at age 35 a woman undergo a mammography examination as a baseline study.
So they can see how her breast is to begin with.
That's correct.
To compare it with something later on.
Absolutely right. And the next thing that should occur is at age 40, irrespective of change, in that ensuing 5-year period, the patient should undergo another mammography examination. Then thereafter, on an annual basis, and more frequently if the family history is positive for breast cancer.
Family history of breast cancer.
Yes.
Right. And there is a higher incidence of breast cancer in a lady if there has already been breast cancer in the family.
That's what we're told.
Right. I want to thank you very much for joining us today on the Medical Explorer. I really appreciate this.
It's been my pleasure.
Hopefully we can have you back and head over on a future show and look at the CAT scanner at Rideout. That would be a nice thing to do, too.
Fine. Thank you.
Thank you. Dr. Silverbach certainly did an excellent job today explaining and demonstrating the use of their new mammography machine. When we return, we will discuss more about cancer with Dr. Robert Polhemus, one of our area's excellent specialists in internal medicine.